Today I'm going to give you 3 practical tips to pass PLAB 2. Want to know the best tips to pass PLAB 2? Stick around for my 3 practical tips. If you're new to this channel, hi, my name is Dr. Erwin. I help high performers create habits to lead a happy and successful life. I publish new video every Thursday on the subject of happiness and success. If you don't want to miss any future video, don't forget to subscribe and ring the bell. Imagine yourself being able to practice medicine in the NHS. You can advance your career and work in the UK. Passing PLAB 2 is an important part of your journey before you can practice medicine in the UK. Today I will give you 3 tips to pass PLAB 2. These top tips are informed from examiners who have evaluated the OSCE performance of previous candidates sitting PLAB 2. Tip number 1. Understand the instructions given. Each station is designed to test your ability to apply knowledge and care for patients. Examiners have noted that some candidates do not grasp what the station is about. Candidates who are not clear what is being asked are at risk of not completing the task at hand. This leads to poor performance. In the 1.5 minutes you have between scenarios, make sure you read the instructions and patient information carefully. It is worth reading the instruction more than once to check your understanding. Do not assume you know the station because you have practiced a similar scenario. Examiners have a bank of scenarios with variations on different topics. It is paramount you check that you understand what you're being asked to do before stepping in a station. Once you've read the instructions carefully, envision yourself performing the task before the station starts. Let's go over a sample OSCE station. In the 1.5 minutes when you stand outside of the station, you will have something to read. The information contains patient information and the instruction to complete in the station. The first line tells you your position and which department you work in. So you are a foundation year 2 doctor in a rheumatology unit. The department you work in is important because if you are in emergency department or in GP, then your management may change. You're given information about your patient, John Smith, age 40. He has been referred by his GP. This is the information about the patient's presentation. So the patient presents with pain in his right big toe. Sometimes you may not be given specific information. The next line is about the instruction. You're instructed to assess and manage the patient. Sometimes it might say, you must assess the patient and discuss the management with the examiner. In which case, you need to discuss your management with the examiner, not the patient. If you have already stepped in the room and find yourself unsure about the instructions, don't be afraid to look at them again. They will also be available in the room. Tip number 2. Prepare for psychiatric stations. Psychiatric stations are typically feared by candidates who may have limited experience carrying out mental health assessment. 1 in 4 people in the UK will experience mental health problems each year. Examiners regularly test candidates' ability to manage patients with mental health problems. Make sure you are competent in managing patients presenting with anxiety, low mood, psychotic features, and alcohol abuse. You need to be sensitive and show good interpersonal skills during your consultation. Similar to medical history, eliciting a psychiatric history requires structure. How confident are you in performing a mental state examination? A key skill in psychiatric station is to be able to assess suicide risk. Patients at risk of harm to themselves or others can be detained under Mental Health Act for assessment and treatment. The Mental Health Act 1983 is a legislation that covers the assessment, treatment, and rights of people with a mental health disorder. It is important you have a sound understanding of mental health in the UK. Last but not least, tip number 3, recognition and management in acute care. Recognizing and being able to manage acutely ill patients are competencies regularly tested in PLAB 2. Acute care requires a different approach to routine consultation. If you're called to see a patient suffering with a life-threatening condition, it's important to keep your calm and stay in control of the situation. Use ABCDE approach, airway, breathing, circulation, disability and exposure to assessing the acutely unwell or collapsed patient. You need to show you can work at the same level as a foundation year 2 doctor to pass PLAB 2. The role of the FY2 doctor in emergency department is to carry an initial assessment, stabilize a patient, and prioritize tasks according to clinical urgency. Your role is to formulate an initial management and recognize when you need to request blood glucose, a 12-lead ECG, an arterial blood gas, and to initiate management such as fluid challenge. Examiners have noted candidates do not always know the correct protocol in emergency management situations. It is important to familiarize yourself with resuscitation guidelines and to know how to apply protocols effectively. Do you know the protocol for sepsis, anaphylaxis, or trauma? Be prepared to apply BLS and show capacity to provide trauma care with primary and secondary survey. Good preparation is necessary to be able to manage acutely ill patients. Candidates need to develop a structured approach and apply the correct emergency management protocol. Let's recap the 3 tips we've talked today. Tip number 1, understand the instructions given. Make sure you read carefully the instruction and the information given to you before you step in the station. Tip number 2, prepare for psychiatric stations. Psychiatric stations can be stressful, but if you prepare and you've practiced your risk assessment and you've practiced history taking and assessment of mental state, you will be able to perform well in these stations. Finally, tip number 3, recognition and management of acutely ill patients. Be sure to learn emergency management protocols and that you're comfortable in applying them and being able to manage a patient who is acutely unwell. There you go, those are the 3 practical tips to pass PLAB 2. If you like this video, subscribe to my channel where I'm sharing more great tips just like these every week. Thanks so much for watching. Take care everybody. See you in the next video.